Knock, knock, knock.
Come in.
All right. Hi, my name is Emma. I'm going to be your nurse today. Can I get your name and date of birth?
Rylan Myron, 7/8/2000.
Okay. I would provide privacy and perform hand hygiene. Okay. So what brings you in today, Rylan?
Just a general checkup.
Checkup? Okay. Sounds good. I'm just going to ask you a few questions before we get going about your history. So, do you have a history of smoking, e-cigs,
No.
cigarettes, anything like that? History of serious or chronic illnesses?
No.
No. And have you had any surgeries or operations?
Yes, one.
What was that?
I got my wisdom teeth out about 2 years ago.
Okay, sounds good. Just a few questions about your family history. Does anyone in your family have a history of cancer?
Yes. We have a history of skin cancer.
Okay, sounds good. Does anyone in your family have a history of hypertension?
No.
Heart failure?
No.
Okay. Are you taking any medications right now, including vitamins and herbal supplements?
Yes.
Okay, what do you take?
300 milligrams of Lamictal a day.
Okay, and what's that for?
Seizure disorder.
Okay. Do you have any allergies, medications, environmental, otherwise?
No.
All right. And are you up to date on all of your vaccinations?
Yes.
Okay, sounds good. Do you have any pain today?
No.
Anything specific you want assessed?
No.
No? Okay, sounds good. I am going to begin my assessment then. I'm just going to go from head to toe, assessing all the body systems, checking for any abnormalities. All right, so first I'm just going to check your scalp for any lesions, moles. All right, looks good. I'm just going to feel your lymph nodes. Let me know if there's any pain when I palpate them. Any pain?
No.
Any there? Okay, sounds good. Can I have you stand up? I'm going to check your gait. So if you would just walk this way for me and back, checking to make sure that the arms swing collaterally. All right. And then can you please stand here with your feet together, arms down? We are going to do the Romberg test. So I want you to close your eyes. I'm just going to give you a slight push. Make sure that he does not lose balance. And you did not, so that's good. You can open your eyes. I'm going to do a few range of motion tests quick. So first, can you look at me and I'll have you clench your jaw. Feeling for that muscle, okay. And then open and close your jaw. And then side to side. And then open with resistance. Good. Okay. Now I would like you to bend over all the way, and I'm going to inspect the spine, palpating to make sure that it is even, going straight down, no scoliosis, lordosis, anything like that. And it looks good. Okay. Now I'm going to have you raise your shoulders, and then with resistance. Good. Bend at the elbow, and with resistance. Good. Move your elbows. Good. Then I would like you to move your wrists, spin those around, fingers. Good. And then starting at the hips, bend to each side, and forwards and backwards. Good. Move at your knee, smoothing it out. Good. We would be checking on both sides of the body, but for time right now, we're just going to do one side. Ankles, I'm going to have you move your ankle in with resistance and then out. Good. And then move your toes. Good. All right, that all looks good. You can sit back down. He has full range of motion everywhere with resistance, so I would rate him a 5. Okay. Then I'm going to have to check coordination. So I'm going to hold my finger, move your finger to mine, to your nose, follow it, okay? All right, and he was able to do that, so that is a good sign. I'm going to inspect the skin, looking for any abnormalities with moles. That would be different colors within one mole, not round borders. Yeah, okay, so I'm just going to check your back here. Okay, good, none that I see. I'll feel the skin for temperature. Feeling the lower calves, checking for coolness, that could indicate DVT. And while I'm down here, I'll also just check for any edema or pitting edema by pressing. No edema, no pitting edema, so I would rate him at a 0. However, it could go up to a 4 if there was pitting edema. Then I'm just going to assess his turgor right here above the clavicle. I will pull up, and that goes right back down, which is a good sign, no dehydration. And then just assessing for capillary refill, which is less than 2 seconds, which is a good sign, and there's no clubbing of the fingernails. Okay, now I'm going to do some sensory tests. So I'm gonna have you close your eyes. We're gonna first test smell. And can you identify this smell for me?
Vinegar.
Yes, okay, so that was vinegar. I would like you to just blow out of each nostril, closing the other one. Good, I'm going to just assess the nose. Good, good. All right, and then I'm going to check in the ears. I do not have the proper equipment to do a full ear check, but just to make sure that nothing is coming out of them. No fluids. All right, we are good. Then I'm going to perform the whisper test, just whispering a common word on one side, and I want you to let me know what I say.
Apple.
Okay, and on this side.
Banana.
Okay, good. He was able to identify both of those. So now we're just going to do some eye checks. One of the eye checks that we would normally perform would be the distance test. I would have the chart with the letters held up, and he would read from a distance covering one eye. I do not have that chart right now, but we would do that. I'm going to check the eyes to make sure that they constrict with light and dilate without it. So, all right, and they both constrict and they both dilate when the light is removed. I'm going to check your peripheral vision. I want you to just turn your body this way a little bit, and then let me know when you are able to see my hands.
See him.
Okay.
See him. See him.
All right, good. That is all good. We're going to check all 6 fields of vision. So I'm just going to have you follow my finger without moving your head. Okay. All right. Good. He was able to do that. Then I'm going to move my finger in towards your nose. Follow that. All right. Checking for accommodation, and the pupils should move in and constrict when I do that, which they did. Pupil size is 3 to 5 millimeters is what it should be. Those look about good. So everything's good there. That is all for the eye checks. Then can I have you smile and frown and puff out your cheeks? Okay, just making sure all the facial muscles are good. I am going to now swipe a object across your face. Let me know if it is sharp or dull.
Sharp.
And
Dull.
okay, sounds good. So I was just using a pencil and a Q-tip for that. And then I'm not going to test your gag reflex right now. However, I would, using a popsicle stick, I would place that on the back of the tongue and then make sure it gags. I'm going to check just in your mouth right now to see that the uvula is centered and not moving towards one side. Looks like you still have your tonsils in. Okay. Gums are good. Tongue is good. Both are pink. Teeth are white. And then one thing I did forget to assess during the eye assessment is, can I have you just look up and then I pull down, checking the conjunctiva to make sure that that is pink and okay. And that is all for the facial sensory ones. All right, now we are going to continue by listening and checking for all the pulses. So we're going to start with your carotid pulse on the neck. Okay, good. Feel over here. In the arm. Behind the knee. On the inside of the ankle here. And then the fetal pulse. And then I would grade those pulses, so I felt all the pulses, I would grade them at a 3. Now I am just going to check the reflexes. I do not have a reflex hammer, so I'm just going to be using this. In an actual situation, I would have him seated where his legs are not touching the ground, and you would actually be able to see the reflexes. All right, so the first one is right here. Then place your arm like this. There we go. Right there. Right here. Like that. Then I would go on the knee. The back of the ankle right back here. And then I'm going to do the Babinski test. Swiping this up your foot. And his toes curled in, which is a good sign for adults. Babies, their feet will curl out. And that is okay for babies up to 2 years old. Next, can I just have you spin your neck in a circle for me? Okay, good. Just checking the range of motion in the neck. Now we are going to do a respiratory assessment. So the first thing I'm going to check for is just inspecting, looking for barrel chest, which you do not have, and that is a good thing. Now I'm going to palpate on the back. Okay, percuss. And then I'm going to check for tactile firmitus. I just want you to repeat 99, 99, 99 as I move down.
Okay, 99, 99, 99, 99, 99.
Okay, good. Checking for symmetry and that I can feel vibrations the same on both sides when he does that. And then I would once again check that in the front of the body using this part of my hand.
99, 99, 99.
Okay, good. Now I am going to use the diaphragm of my stethoscope to listen to his breath sound starting on the posterior side. Okay, and I'm just going to note that I will be doing this on one side of the back and one side on the front. However, in a normal assessment, you would complete it on both sides to check for symmetry. Okay. And then I'm going to ask you to breathe in and breathe out. Okay, good. And now I am going to do the same check on the front. The first one is right here above the clavicle. Okay, and everything sounds good there. No wheezing or rhonchi. Then I'm going to use the bell of my stethoscope to listen for a carotid bruit on the neck. All right, and we're good there. That is typically more common in adults around 40 years old and older. Now I'm just going to do a cardiac assessment, so listening to the heart using the diaphragm and the bell. So first I will start with the diaphragm. Everything sounds good. Hearing normal S1 and S2 sounds. Now I'm going to use the bell and listen. All right, and again, everything there sounds good. Now I'm going to check over here below the nipple line at the apical pulse for 1 minute and count that pulse. All right, and then that is good. I would also assess for the patient's respiratory rate. Oh, geez. So, if the patient was laying, I would check his respiratory rate. So I will do that when we do your abdomen assessment, which we'll do right now, actually. So, lay down. Okay. So first I am going to inspect the abdomen. All right, everything is good. And before I do any percussing or palpating, I am going to first listen in all 4 quadrants. Okay, and I could hear bowel sounds in all quadrants, which is a good sign. A absence of bowel sounds is a medical emergency, so that is good. Next, I'm going to just percuss the abdomen. And then palpate. All right, and that is good as well. I am going to use the bell of my stethoscope to listen. Again, I should have listened with the bell before I would percuss or palpate, being that if you percuss or palpate, you could move things around and change the sounds in your bowel. Okay, and that is good. And then using an object again, I am just going to scrape on the abdomen and check to see that the abdomen muscles flex. All right, which they did, and that is a good sign. All right, you can sit up, Rylan. That would complete my full body assessment. Everything checked out good. There were no abnormalities as we went through. I'm just going to go through some patient teachings. So everything in your assessment was good. There's nothing to worry about. However, I did want to talk to you about wearing sunscreen, being that you do have a family history of skin cancer. Do you typically wear sunscreen?
Sometimes, but not always.
Okay. It's very important to wear sunscreen, help you to protect you from the damaging UV rays of the sun. Usually using an SPF 15 or higher is best. Anything under 15, they can't actually protect you from the sun for sure. So making sure that you're using a good sunscreen and checking for any abnormalities in your moles yourself. So make sure that they're not discolored, that they have boundary that you can see, they're not raised, anything like that. And if they are, to go get those checked out, because that can be a sign of skin cancer. And then I will provide you with a pamphlet here on protection of your skin and how to do that. Do you have any other questions for me?
No,
today?
I should be good.
No? Okay.
Thank you.
Sounds good.